Hi, everybody. This is Dr. Wright, and I want to talk about a very important and often neglected part of the treatment of lipedema, and that's compression in lipedema. So, compression in lipedema is very poorly understood and poorly implemented and poorly appreciated by patients with lipedema and providers. So, let's get down into it. And let me share this. So now some of the research I'm going to share with this was supported by Tactile Medical, and I've also been a speaker for them to help educate providers about lipedema and lymphedema. Okay, the benefits of compression. So compression has so many important benefits. It helps smooth lobules and cuffs. And so, lobules and cuffs are either going to get bigger if they're not compressed or and grow, or they're going to get reduced and decreased if they're contained and compressed with proper compression. So it's a dynamic thing, and absent wearing compression, they tend to get bigger and worsen. Compression improves mobility and get into that a little more. It decreases pain. And compression garments have an anti-inflammatory property. So we know that the lymphatic stasis that occurs in lipedema and lymphedema and other diseases is this is decreased with compression, and that lymphatic stasis is pro-inflammatory, creates inflammation in the tissues. It's responsible for some of the pain that women with lipedema, and is also responsible for the fibrosis that occurs in the tissues as lipedema progresses. That the fibrosis is we feel as the nodules. Compression decreases edema and does give a slight decrease in limb size. It also improves overall venous and lymphatic function, leading to improved health of the skin and proper clearance of waste. And finally, compression is really the cornerstone on which the many of our lipedema treatments are built upon. Manual lymph drainage. It, it, it it maintains the benefits of after pumps or manual lymph drainage. It is critical for the results of the surgery, and we feel like the compression also in the anti-inflammatory effects allows the diet to work better. So it has a lot of powerful things. Next, I'm going to get the next slide. So this is a slide of results from a study published by Atan in just the last couple of years, and it has a couple different compression. One was just complete decongestive therapy, and one is compression pumps, and they all led to lower pain in lipedema ladies. So, and then this is another slide by Dr. Tan last year or 2 years ago, and it shows that the limb volume decreased with different wraps and different compression devices in the lipedema ladies. So this is results from a study I published just last year, and I also showed decrease in limb size with compression, uh, and it and additionally adding a compression pump further decreased the limb size. And the limb size decreased at every area we measured except the hip. So the ankle, calf, knee, thigh, all decreased in size. The hip actually slightly increased in size, and then the waist also decreased in size. And now the compression pump really the benefits you see here with the compression pump are really when they're used in combination with the compression. And so, as many people may not know, that if you use a compression pump, you do get immediate benefits, but those can be quickly erased if you don't put the limb in compression after the compression pump, and they will swell and fill again very quickly. I just want to explain a little bit about bioimpedance, and which is just a tiny electrical current. You can't even feel it. It can give information about the intracellular and extracellular water. So the high frequency goes through everything, including the cells, and then the lower frequency just goes in the extracellular water. And then you can add and subtract these currents through different segments of the body to get the amount of in extracellular fluid in say the legs or arms or trunk. And this is some results of my recently published study, and we showed that the bioimpedance, or the extracell, which is really the extracellular water over the total body water, decreased in our lipedema ladies wearing compression. And this is I just want to put this in comparison. The change that we saw was equivalent to the change between a normal limb and a limb with lymphedema. So it's quite, I mean, while the numbers don't look that impressive, they are amount to a pretty significant change, and kind of the change. We know that and the fluid is doing lots of bad things in someone with lymphedema and lipedema. So this is just a little explanation about. So we saw this decrease in extracellular water, but what is that? And that is, since the plasma volume is tightly regulated, really that extracellular water is really just interstitial or tissue edema plus what's in the lymph. And so that's we know that that's where the compression is working. So what I just showed you shows there's evidence of interstitial edema in lipedema, and really and lymphatic stasis, and then and this really puts it on a continuum of lymphatic problems with lymphedema, and so really it further implores further informs our understanding of lipedema and the need for compression, because we know in lymphedema, where there's generally more impairment in lymphatic function, that complications. I mean, it's just the different growth, the growth rate and fibrosis of a limb that's not wearing compression versus wearing compression is significant, and really is almost tragic if in someone with lymphedema who doesn't wear compression. And so we really can infer from that while there's less impairment in lipedema, we know if understand how important it is, it really should be better used. And there's a study came out in 2020 by Lisa McIntyre, which showed that only 70% of lipedema patients regularly wear compression, and that's just a shame. And obviously they could benefit more. More lipedema patients would benefit from it. Okay, so when they surveyed this further in the study, when she surveyed the reasons for wearing the compression, they feel 73% reported they feel supported. They all 67% reported reduced pain, and 54% reported it improved their mobility. So now we know how important. I've kind of gone through how important it is, but it's obviously. I also shared how it's not not implemented or used as much as it should be, and that's partly because of it's hard to wear. I mean, lipedema ladies have tenderness, and so now so sometimes they have to work their way into the proper compression strength that's going to do the most benefit. So maybe they start with a less um, a less rigid or a lower strength compression, which will reduce the inflammation and a lot and pain, and then they're able to tolerate better compression, which is going to have even more benefit. So but it's tough, and it has to be properly fitting. Obviously, if it's lipedema ladies have unique shapes, and so sometimes we do combinations, but in make different adjustments. But obviously, going to be the best is going to be custom made, because it's going to fit their unique shape. But we're going to talk more about the proper material and strength to really get these benefits I just showed you about. And it's also critical that it's applied or donned properly, so that there's no gaps or little ridges in it that will create tourniquets and can make it feel uncomfortable. So it's very there. It's not, I really appreciate it. It's not the easiest thing to do. It can take a good bit of work. So let's talk about what all the benefits are seen with medical grade, at least at 20 to 30 or 30 to 40 sometimes, graduated compression. And so so medical grade is always going to go down at least to part of the foot, and it's going to be graduated in that it's going to have the highest compression strength is going to be at the ankle, and it's going to decrease as it goes up the limb, and that's going to create a gradient to ensure that the lymph and interstitial fluid goes up towards the lymph nodes and where it needs to. So circular knit, there are types of compression. Circular knit is the least expensive, but it's also the one that's going to give the most problems. It's gonna bunch up and create can tourniquet and can cause pain if it's not exactly put on smooth, and has to be constantly readjusted because it'll want to slide down and so it. But the advantage is it's least expensive, and it doesn't have to be custom made. Flat knit is the best. I mean, it's going to give you it's going to give the most support to the lobules and cuffs. It is going to be the most comfortable because it's not but it's a thicker material, but it's going to be the most comfortable in terms of treating the inflammation in the tissues. And then weaves can also be more comfortable, but there's a lot of weaves that are on the market. Like BioFlect is a weave, but it's not medical grade, and it doesn't there's no evidence that it can give the benefits I spoke of. And then the final thing are these Velcro appliances. And now these are more expensive. They need adjustments, and they'll slip and fall, and they can be hard, especially on the thigh, to wear. But they do great compression. So the flat knit and the Velcro appliances have the highest working pressure, and that's does the most benefit, and the least resting pressure, which is what the resting pressure can make them hurt over when they're worn for a long period of time. So they're going to be the best, but they're the Velcro and the flat knit, but they're gonna be the most expensive. So here's some good news: is the Lymphedema Treatment Act. It was passed in December 2022 and goes into effect in 2024. Patients must, so it is for lymphedema. So, but about 70 or 80% of ladies with lipedema have evidence of some secondary lymphedema. But you would need the diagnosis of lymphedema to get the benefit benefit or you use the lymphedema tracker. So it's hoped that this will improve coverage for compression garments prescribed by physicians. That's um, of course it is only for Medicare, but often the other payers do follow suit. And we have no idea whether this will have any effect on lymphedema surgery. Um, you know, probably not, honestly, but and currently there is no Medicare does not have a coverage for that. Um, and then just finally, I just want to put a little plug for Lipedema World Alliance. It's it's a group of patient organizations across the world and a group of scientists dedicated to spreading awareness and understanding and the best scientific um, um, scientific evidence of the best treatments. And so we want to put a word out for that. I encourage anybody to look into Lipedema World Alliance and see if they can help. So thank you so much for everybody for you know listening to me and something I obviously care very deeply about and hope it was of some help to you. And that's it. And I'll see you on the backside if you like this. I'm trying to do more videos to explain how about lipedema treatment. And thank you again.